All right, so a quick little video on genetic testing, basically the hows and the whys, so the methods of doing it and why we do it. There's a bunch of different ways you can do genetic testing. Sometimes it's as simple as a saliva test or a cheek swab. Sometimes it's a blood test. Sometimes, if you're looking at prenatal testing, it is an amniocentesis where they stick a big old needle in your amniotic sac and pull out some amniotic fluid because it has some of the baby's skin cells in it, and so they can get DNA from that. And then chorionic villi testing, they have to go in through the vagina and into the mother that way and be very careful to get a piece of the placenta that contains some of the baby's cells. And they do all that very carefully. They do all of that with ultrasound so they don't accidentally hurt the baby or do anything they don't want to. So that's how they're going to get the DNA. That's the methods of doing it. Is either they either got to get some kind of cell from the body, um, or they have to get some kind of cell from the body. I guess that's what I should say. But they could be like a skin cell, or it could be like a blood cell. But why do we do it? Is there? This is a bigger thing. It could be for diagnostic. Maybe you're having some symptoms and you want to know, and the doctor says, "I think it's this genetic disorder," and so you're going to be diagnosed with that. You could also, the second one, pre-symptomatic and predictive testing, is maybe something runs in your family, like Huntington's, and you want to know if you have the gene for that. And so you don't have any symptoms yet, you're pre-symptomatic, but you want to know what is your likelihood of having it in the future. You can also be carrier tested. So if you are looking at starting a family, but there's a genetic condition that runs in your family, you might want to be tested to see what the chance is of you passing it down to your children. If you and your husband carrier are carriers, then it increases your chances. And some people choose to go through alternate methods to have children so that they don't pass it down to their kids through either adoption or IVF, where they have the embryos tested so they know their child doesn't have it before it's implanted. Um, versus if you're a carrier and your husband doesn't have it and it's a recessive condition, then there's no worry because your kids are not going to have it. They might have the gene, but they won't have the condition. Pharmacogenetics, this is really big, especially with cancer treatment right now. They are looking at tailoring your chemotherapy or your medications if it's not chemotherapy, and the dosage of that medication based on your genetics because different people react to different medicines in different ways. We also use it for prenatal testing if they think based on ultrasound or the way the baby's measuring that something might be wrong. They can do amniocentesis or chorionic villi sampling to figure out if anything is going on with the baby. Newborn screening, all newborns are screened. I don't remember the number. They told me when Micah was born, I want to say 12 or 14. They do just a little heel prick and get a little blood out of their foot. And they put it on this card and they send it off and it's tested for, I don't remember, it might be more than that, it might be like 20 different genetic disorders right at birth so that you know, because there's some things like phenylketonuria that you can really decrease the impact, but you got to know early on. Because there's certain foods they can't eat, and milk is one of them. So you want to make sure that they have special formula and those kinds of things to decrease the symptoms. And then, as I mentioned a minute ago, pre-implantation testing. This is real big now with IVF. They can take the embryos and test. They can take one cell off of those embryos and test it, look at its genetics to determine if there are any genetic disorders and help parents determine which embryos they want to implant. So, lots of different reasons for doing it. Some family oriented and some just for your own personal knowledge. But that is why we do it. If you've got any questions, let me know.